All right, guys, so the next topic is going to be strengthening progression. So we're going to be kind of focusing on the advancement of the strong foot position, also known as arch doming. So you can start this either with a functional activity or with a more isolated movement. Typically, I actually like to start functional, but just to kind of go over some of the common cues that I use, I'm going to start with just an isolated arch dome or an isolated strong foot hold. So some of the common cues that I will typically use in the clinic, so I like to focus on big toe down, and then I can either use the knee via an external rotation cue. So I might tell a patient, push your big toe into the floor and push your knee out. Most of the time that I find that one works the best for me in terms of success rates with patients. And if that one's not working really well, then I might actually try to get some hip external rotation instead. And so I'm gonna ask the patient to do an ipsilateral rotation of the trunk and then try to maintain that position, of course, of pushing the big toe into the ground. And then I might ask them to kind of hold that position and then transition back to normal stance. So again, those are just some of the common cues that I will use initially with a more isolated arch dome. I can even advance from there before working into a functional position by just taking a band, placing it at the midfoot, and at that point going through the same motion of big toe down and then pushing the knees apart, maybe holding for a little bit and then relaxing, and I might go through that a little bit. One of my favorite places to actually start, however, is with a squat. So I'm just gonna start no weight, big toe down into the floor. I'm gonna push my knees apart and I'm gonna go into a partial squat, trying to maintain that position, and then I'm gonna come on up. You'll find that starting with bilateral activities is gonna be easier for a lot of your patients, which is why a squat is one of my favorites. I can eventually add some weight, into a goblet position. Same deal, big toe down, knees apart, and then dropping into a squat. Another bilateral exercise that I like to use is a deadlift. So, maybe I'll start at the top. I'll have my patient push their big toe into the ground, push the knees apart to get some of that external rotation, and then perform my hip hinge. Once I feel pretty good about bilateral movements and they're getting a nice isolated contraction, then I'm gonna consider moving into unilateral focus. So the first exercise I like to start with in terms of the unilateral sequence is gonna be a lunge. So first thing I'm gonna do is kind of start in a split stance position. I'm gonna push my big toe down into the ground, push my knee out, and then I might go ahead and go back into maybe a reverse lunge initially. And you'll notice it's pretty tough to hold that arch dome position, but that's the key here, stressing that to your patient. And then from there, if I want to make it really tough, I might move into a more balanced focus where I can utilize more of an RDL hold with or without weight. And in the essence of kind of finding an activity that's going to be the most functional for your patient, of course, you're going to want to consider what their return to sport activity is going to be or what their return to function is going to be. And so some other things that are important to kind of work into the routine is focusing on balance. So you can maybe even just have your patient do big toes into the ground, push the knees apart, close the eyes. You can transition that, of course, into a single leg balance, same cues, single leg balance with eyes closed. And then, depending on what, again, their return to sport or function activity might be, you can, bring in, of course, some unstable surfaces. One of the later progressions that we really like to use is starting to do more of a triplanar motion. In the real world, we're often going to move in multiple planes, and so preparing your patients for those activities is going to be critical. So We can play around with a triplanar lunge, a triplanar RDL, or even just a cone tap. So I might set a couple cones down in all kinds of different directions. Ask my patient to stand on one leg, push the big toe into the ground, push the knee out, and then we can do just a tap drill where I'm trying to maintain that position, maybe even giving some really close feedback and cues, giving them some information whether or not they're collapsing or doing a good job of maintaining. You know, we could even transition into, you know, reaching with a hand. So this is kind of like a single leg RDL, except now we're challenging to reach in multiple planes. And as you can see, it's a pretty challenging one. And we can do something similar, of course, with a transition from just a normal lunge to, you know, going into a reverse lunge, going into maybe a lateral lunge, and then just kind of advancing again based on the activity that your patient's trying to get back to. So these are just some of the common progressions that we'll use in the clinic, and these are just some good ideas, of course. Try to tailor it towards your patient specifically.